Do you know that one of your routine pregnancy drugs prevents your baby from being born with a large amount of your baby's spinal cord hanging outside its body? Crazy, right? These routine pregnancy drugs prescribed by your physician help you and your baby in many ways, and that's what we will be discussing today. So let's get into it. Folic acid. Taking folic acid during your pregnancy, especially in the early stages, helps to lower the risk of defects in your baby's spinal cord and brain. Folic acid is a man-made form of folate or vitamin B that helps for proper development of your baby's neural tube, which eventually forms the brain and spinal cord of your baby. Taking folic acid from as early as 3 weeks of pregnancy can prevent birth defects like spinal bifida, meaning incomplete development of the spinal cord or the vertebrae, and anencephaly, which means incomplete development of major parts of your baby's brain. Babies with anencephaly usually do not live long, and those with spina bifida may be permanently disabled at birth. Folate can also be gotten naturally from nuts, peas, beans, and dark green leafy vegetables. You can also get it from oranges, melons, and bananas. Ferrous sulfate, iron. Ferrous sulfate or iron is vital to your baby's development throughout your pregnancy. It is necessary for the production of healthy red blood cells. As you may know, your red blood cells are responsible for transporting and delivering oxygen and nutrients to your body's tissues, as well as your baby's. So you get why iron is important, right? Iron also supports the development of your baby's placenta. Lack of this essential supplement can lead to iron deficiency anemia, which may further lead to premature birth for your baby. Foods like turkey, fish, eggs, seafood, and chicken, thank goodness, can also give a pretty good amount of iron and help you avoid these complications. Vitamins B complex, C, and D. Vitamins are always recommended during pregnancy because they are super important. Here are some vitamins and what they actually do, but before we continue, kindly remember to like and subscribe so we can help you have a healthier pregnancy. Vitamin B complex. Vitamin B complex refers to the group of 8 water-soluble B vitamins that are essential during your pregnancy. Folate is the most important of them all, which is why we discussed it earlier. The others are vitamins B1, B2, B3, B5, B6, B7, and B12. Each of these vitamins plays a huge role in your baby's brain development and generally lowers birth defect risk. For you as an expecting mother, they also help control energy levels, ease the effect of nausea, and lower the risk of preeclampsia, a dangerous pregnancy condition where you have high blood pressure and proteins in your urine. While these vitamins can be gotten from supplements, you can also get them from food sources like meats, poultry, fish, dairy products, carrots, cabbage, and the list goes on. Vitamin C. Vitamin C is another super important vitamin that has many uses. For instance, it is an essential component in collagen development, which is a structural protein found in your baby's bones, tendons, cartilage, and skin. Vitamin C also strengthens you and your baby's immune systems and offer protection against oxidative damage. Additionally, vitamin C supports tissue repair and wound healing and helps your baby absorb and store iron for future use. Ensure you get as much vitamin C in your diet as possible because a deficiency of this vitamin may leave you at risk of poor wound healing, anemia, preeclampsia, and your baby at risk of prematurity and low birth weight. Like every other vitamin, this can be obtained from supplements, but you can also get it from food sources like citrus, bell peppers, tomatoes, strawberries, green beans, and papaya. Vitamin D. Vitamin D is very important to your baby. It helps develop your baby's immune system and its function and is responsible for bone health and healthy cell division. Vitamin D also facilitates the absorption and metabolism of phosphorus and calcium. If you don't get enough vitamin D throughout your pregnancy, your baby may develop soft or deformed bones. So you can avoid this by eating foods like cod liver oil, milk, salmon, and egg yolk. Supplementation is also an option to consider, although you should know that there are 2 types of vitamin D: ergocalciferol, which is the vegan form, and cholecalciferol, which is sourced from animals, sheep and fish. Cholecalciferol is, however, the more absorbable and utilized type for the body. An alternative and cheaper source is sunshine. How much sunshine do you get daily? Tell us in the comment section. Tetanus toxoid vaccine. Tetanus toxoid is a vaccine that prevents you from developing a tetanus infection if it ever gets introduced into your system. But what is tetanus infection? Tetanus infection is a dangerous bacterial infection that can affect your nervous system, cause extremely painful muscle spasms, and, ultimately, death. While pregnant, your immune system and that of your baby are altered. So, a tetanus infection while pregnant can be deadly to you and your baby. The best way to prevent this is to get a vaccine long before your baby is born. Every expecting mother is expected to get one, and you should not be the odd one out, at least for your baby's sake. This way, your baby is immune for a while after delivery. The first dosage is usually recommended in the 3rd trimester, usually in the 7th month of your pregnancy. The second dosage is given 4 weeks after the first dosage. The third dosage is usually given 6 months after the second dosage, depending on numerous factors. Keep your vaccine card handy, just in case you change your physician. Iodine. Now this isn't Lugol's iodine as in the disinfectant, it's iodine, the supplement. Iodine is one of the most important minerals in your body. It is essential for the production and regulation of your thyroid hormones. See, the thyroid hormones are responsible for several body activities like metabolism, growth, and bone development. Also, thyroid hormones are responsible for the development of your baby's skeletal and nervous system and the brain. During pregnancy, your body demands more iodine than usual because it's necessary for the production of thyroid hormones for you and your baby. This is because thyroid hormones during pregnancy are depleted due to a higher demand for them. If your body lacks iodine and thyroid hormones, you may be at risk of hypothyroidism, and your baby may also be at risk of developing irreversible brain damage. So you see, iodine is such a useful mineral that without it, you just might not exist. You should also know that there are pretty simple food sources of iodine like full-fat milk. Eggs, lima beans, seaweed, strawberries, cranberries, shrimp, baked potato, oysters, iodized salt, and beef liver. Adding these foods to your diet will help a great deal. Zinc. Zinc is one of the most important supplements for your baby because it is essential in numerous phases of your baby's development. While it plays an important role in cell growth is very rapid when you're pregnant. It is also vital in developing, functioning, and maintaining your baby's genetic print or DNA. Crazy, right? Like many other drugs we've mentioned, zinc is vital in energy production and supports your immune system. It also helps you to maintain your sense of smell and supports rapid healing. Without zinc, you may be predisposed to preterm delivery and prolonged labor. To avoid these, you can eat zinc-rich foods like chicken, crab, low-fat yogurt, kidney beans, almonds, cheese, and meat. The best source of zinc is oysters, so you might want to order Chinese more frequently than not. But you have to be careful. Raw oysters are not so good for you and your baby. Calcium. Calcium is another vital mineral during your pregnancy simply because it supports the muscular, skeletal, circulatory, and nervous systems of you and your baby. While it supports the growth and development of your baby's bones and teeth, it also ensures that your bones are constantly capable of carrying your weight and the baby's throughout the pregnancy. If you do not take enough, your body will give what's left to your baby, placing you at a high risk of bone failure. Thankfully, the best source of calcium is anything dairy. If you're lactose intolerant, not to worry, we've got you covered. You can get calcium from other sources like collard greens, broccoli, kale, green soybeans, cheese, yogurt, dried figs, cress, wakame, fortified foods, and oranges. Every single supplement or drug you take when pregnant is highly important. Ensure you consult your doctor before taking any drug, and be sure always to follow instructions and know if the drug is the right one for you and your baby. If you were not aware of what your routine pregnancy drugs do, well, now you do. Don't forget to hit the subscribe button. Be the first to learn the intricacies of your amazing pregnancy journey.